questions. I think we're running out of time pretty quickly here.
I'll be short. I think the answer is yes. I'll give you a real example. And so while it sounds like a political statement, I actually applaud the efforts of Chairman Hamburg, because I think she's trying to look at this and say, well, you know, how do we get our arms around something that's brand new? There's an inevitability about mobility, right? I mean, it's such a big societal thing that says, like, either you're going to fight it, you're going to lose, or you're going to become part of it. You're going to figure out how to make it work within your. So they came to us as this accessory and said, well, every new phone that you put WellDoc on will have to go through a separate submission. And we're like, wait a minute. I mean, I look at our, like, there's thousands of phones we have to, all we're going to be doing for running a business is writing submissions. We got them to the point where we said, look, you guys are really interested in minimizing patient risk, right? And risk for them is the product of the occurrence of an adverse event times the severity of that adverse event. That's how they measure risk. It's probability times severity, okay? So they said, we got them to the point and said, look, there's actually 3 types of phones, and there's only 3 types of phones you should consider. One is that has an alphanumeric keypad, right? Because there's a certain risk a patient may with small buttons or big buttons or whatever. There's a second class that has a QWERTY keyboard, that it's a, you know, you can type like a BlackBerry. And then there's a third one, which is a touch screen, right? And we said, fine. If we can show that the patient, if you give the same patient or groups of patients all 3 classes of devices, and they can do the same transactions and get to the same place without incurring any new probability risk or severity risk, then you know what? Maybe that's the way out. And that's something that they bought and said, okay, fine. Submit it for this, and then, so I think they're learning. I think they're wanting to learn. And I think now the monkey is on our backs. If we don't help them understand and educate them, the same way they educated us on, we hired, you know, our quality systems VP came from Siemens Medical and she ran, so we're hiring people to understand their world. I think they're making the steps to help understand our world, and it's now our responsibility here to help continue that journey.
Great, thank you. So this has been a pretty quick hour already, but I want to make sure we have plenty of time for questions from the audience. If there are any to start, we can take one now. Yes, sir.
Well, again, this is follow-up to the meaningful use. We talked in that last panel earlier about the whole issue of healthcare facilities pushing meaningful use with a healthcare reform and having providers get a bonus if they adopt EHRs. But it was kind of a loaded question when I asked it early in the morning, because I really think we should be giving patient, the consumers, some kind of break. Because if you can get the patients fully engaged, sort of like a lost leader when you go to a grocery store and you buy a turkey for Thanksgiving, you buy $30 other worth of groceries. If we do something short-term by giving the patient perhaps some kind of compensation by adopting technology to upload information into the PHR, then it opens up the whole can of worms. Okay, so what, as a patient, what do you want me to write to? So is it going to be Microsoft Vault or the Google Health or so? But I think that to me is the way to incentivize this, is to get the patient some kind of tax break or some kind of incentive, get them now populating something that we can all go to and pull from, and then build on that and offload the medical providers. And I was wondering if you guys had any thoughts on that in terms of your business planning. But the question is, so who takes that forward and to whom? And so I just leave that for open discussion.
Well, I'd say better yet, rather than rewarding consumers for uploading their data to PHRs, which I don't know is actually going to have any impact, let's reward them for actually making progress on actual conditions. So, you know, that would be the ideal situation. And, you know, to just be completely crazy, I've thought, what about a point system that we all created? You know, so you move your glucose readings down by, or your A1C down by 2 points and you win a big screen TV. I mean, let's think out of the box here, because, you know, we've got to start motivating people to engage, and at the end of the day, maybe a point system is the best way to do it.
So two real examples. Colonel, you raise a great point. George Washington University Hospital, Dick Katz, who's running our DC Health Connect project, medical minutes. They actually get, this is homeless people in Washington, D.C., and the results are off the charts. It's amazing how they're engaging these people who they could never engage in the past. So they're actually giving them medical minutes, top off your minutes in a prepaid sense. So that's a great reward. People value that. In the case of what we're doing with AstraZeneca and the pharmaceutical industry to support proper med adherence, I mean, med adherence is not as simple as just, hey, it's time to take your meds. If that were the case, Merck and J&J would have put alarm clocks with every bottle of drug they sold, and that would be the end of it. You have to break down the psychosocial barriers as to why people aren't adhering to their therapies. So what these guys did is they waived their copay if they hit the right refills and they're taking their, and then they waived their next doctor's visit copay, and then they created a point system. They actually did this with Health Honors, a company in Boston. So these are the types of things we need to do. These are the innovative, and when you start to think about, that's the core business of the wireless operators. How do you engage? How do you make these because you can do it, right?
Right. Well, I could do it tomorrow. So I could basically start a point system for our customers for taking their medications on time, for using the live nurse service, for whatever it happens to be.
One of the other ways that this can happen is as time goes by and as we become, as all of us as caretakers for each other, become more aware and have access to information, I think that's another piece of this. It may not be across 100% of the compliance piece of this, of uploading data and actually complying to your medications and your prescriptions and so forth. But one of the ways in which we think this is going to explode is all of us have people in our lives that we are caretakers of, or at least have some interest of. And if I have access to the information that my parents are supposed to be complying with, I then be in a better position to help them with their compliance or sharing information or what they're supposed to do. To date, that has been one of the biggest issues, as we all know. I mean, I don't know. I mean, I can't even tell you what my parents take. I know that when they show up at my house, they have racks of pills, let alone what the doctor just told them at their last visit. But as I get access to that information, and we provide that for each other, I think that's one of the drivers of this information accessibility that will help drive compliance and help drive the fact that, did you upload